This is Dr. Daniel Paul, orthopedic surgeon with Easy Orthopedics, and today we're going to talk about, does a steroid injection get rid of shoulder pain? If you like this video, we put out new content weekly, so please like and subscribe. The short answer is it depends, but for most shoulder pain, yes, it can actually get rid of your shoulder pain. So let's kind of talk about when it works and when it doesn't work. So steroid injections work really well for bursitis or tendinitis. So if you have biceps tendinitis or you have shoulder bursitis, also known as, which can cause shoulder impingement, which is mostly pain in the side of the shoulder, hurts when you sleep, hurts when you lift your arm up. A steroid injection in those areas can be curative, meaning that you inject it, it decreases the inflammation, you're able to do exercises and improve your biomechanics, and the pain just doesn't come back. So in those sorts of areas, it can be really helpful. Those injections aren't in the joint. The subacromial space is above the joint, and the biceps tendon is just a tendon that's in front of the joint. As far as injecting in the joint, if you have shoulder arthritis, it can certainly help with the pain. It's not going to cure the arthritis. If you have labral tears, if it's like a superior or posterior labral tear, it might calm the pain down. But if you're having like a dislocating shoulder, it's not going to fix that. So times when it doesn't work are some pathology that essentially needs to be surgically fixed. So if you have a large rotator cuff tear, you can inject the shoulder, it'll make it feel better, but the pain's going to come back. That rotator cuff tear is still there. Or if you have a labral tear in the front of your shoulder and your shoulder's popping in and out, the steroid injection is not a good option for you. If you have shoulder arthritis, it can be a decent option. Just know that if you want to get a shoulder replacement, you can't do it within 3 months of getting a steroid injection because there's a theoretical risk of infection. So the short answer is that for a majority of people, a well-placed shoulder steroid injection with an accurate diagnosis can get rid of their shoulder pain entirely. For some who have big tears of their labrum or rotator cuff, it's not the right option. But for most people who don't have that stuff, it really is. So I hope I was able to answer your question about, does a steroid injection help with shoulder pain? If you have any questions I didn't answer, feel free to leave them in the comments below, and I'll do my best to respond, but I can't give you specific medical advice about your condition. If you like this video, we put out new content weekly, so please like and subscribe, and thanks for watching.